Welcome to our first installment of the Global Parenting Initiative's webinar series for 2024. It's quite an exciting topic today. I am Genevieve Hauptrani. I'm the Community of Practice Lead for GPI, and I have the honor of chairing this session today. So before we get started, I just want to note a few housekeeping points. This event will be recorded and it will be made publicly available afterwards, probably in about a week's time. We'll be able to find it on our website. To avoid any disruptions, you'll note that only the speakers' cameras and microphones will be active during the session. There is a Q&A session, or hopefully we'll have a Q&A session at the end. I know the speakers have timed it in this way that we'll have some time for Q&A. But there is also an icon at the bottom of the screen, which is a bit different to other platforms, where you can actually click on and you can add your question, and we'll get back to that after the presentation. So let's give a warm welcome to our speakers today. And we have Professor Marguerite Schneider and Dr. Zui Fang with us. Marguerite is an emeritus associate professor from the Alan J. Fletcher Center for Public Health, Mental Health, at the University of Cape Town. And she also supports the GPI Facilitate Group based at the University of Cape Town. She's trained as a speech language pathologist and an audiologist before moving on to applied research in disability studies and public mental health. And Zui is currently a disability research fellow at the School of Social Development and Public Policy at Beijing Normal University, and a key figure in the Global Parenting Initiative, where she leads on projects on developing inclusive parenting resources. So I'll now hand over to Marguerite and Zui, who will be sharing their work on enhancing disability inclusivity in parenting interventions. The speakers have about 40 minutes to present, and then we'll open up for some Q&A. Over to you. I think Margie will be going first.
Thanks, Jen, and welcome everybody. And maybe it shouldn't be exciting that people with disabilities are still so excluded in so many aspects of life. But I think there has been a lot of progress made, and visibility and disability is certainly much more visible. So I'm going to just give a brief theoretical background on what is disability and what is inclusion. And then Zui is going to talk about much more interesting stuff around practical applications of inclusion in parenting programs. So I thought I'd just put this nice slide or picture of all the different symbols around disability. We're so used to just seeing the wheelchair and not much else as a sign of disability. And often when people talk about people with disabilities or disabled people, they tend to think of wheelchair users rather than the whole gamut or wide range of people who do experience disability. Next slide. So starting off with a definition of disability, and the UN Convention on the Rights of Persons with Disabilities was adopted by the UN in 2006, and there's probably over 100 countries that have ratified the convention at various points. And South Africa, for example, was very active in developing the convention and was one of the first countries to ratify it. The preamble talks about recognizing that disability is an evolving concept and that disability results from an interaction between persons with impairments and the attitudinal and environmental barriers that hinder their full and effective participation in society on an equal basis with others. And what's very important here is that it's an evolving concept. Disability is also called a relational concept. It's about a relation between different aspects. And here it's a person that's got this impairment or health condition, and it's a context and environment in which they live that interact. And the environment will have barriers. It will also have facilitators. But it's that interaction and the outcome, which we call disability, or this experience often that is generally one of disadvantage and inequality or inequity. The convention continues to define persons with disabilities as including all those who have long-term physical, mental, intellectual or sensory impairments, which in interaction with various barriers, we've got that interaction again, and the role of the environment, that in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. And I think it's important to understand in the first one around attitudinal and environmental barriers. When we talk about environment or the context in which a person lives, it's about policies, it's about legislation, it's about systems, it's about services, it's about attitudes of people, it's about the physical environment, the built environment, the natural environment, all of those, climate change, all of those aspects make up this environment in which people with impairments find themselves. Next slide, please. So the WHO has the International Classification of Functioning, Disability and Health, which very much embodies, although it was published before the convention came out in 2001, the ICF, or this classification, it also has this very similar definition of having a person that has that has these impairments or a health condition and lives in a context which then interacts. And the ICF looks at four major components that we need to look at. The first one is at a person's body level, so individual limbs, individual body systems, individual, basically systems, structures and things, that something's wrong with them. There's an impairment there. And so a hearing loss, vision impairment, an amputation, spinal cord injury, a cognitive loss, or cognitive impairment, psychiatric illness. All of those are chronic fatigue. All of those things can come up as impairments that will then interact. The person who has them will interact with the context in which they live. The whole person functioning is how the person with these impairments is able to do a range of basic activities as a kind of whole person. So walking, communicating, taking care of domestic activities, working, being able to make decisions, seeing, hearing, interacting with others. All of those are activities that the person is able to do or has difficulty doing. And that's as a combination of the impairments that the person has. But that whole person then again interacts with their context and the environment. And that's when we get this outcome of participation or participation restriction, as the ICF calls it. And so that's the third level. So that's what happens when there is this interaction. What is the outcome? And then the fourth component would be, of course, describing all the environmental aspects, all the barriers and facilitators or environmental factors, as the ICF classification refers to them. Next slide. So I thought this was quite a nice way of describing it. And on the left, you see a person in a wheelchair facing a set of stairs. And that person is very disabled because of it. The outcome is that person cannot participate in whatever's happening in that building because they cannot get there. And of course, you can say, well, people can lift them up. And people in wheelchairs hate that happening because they feel very insecure. When somebody's lifting you up in the stairs, you don't know at what point you're just going to tip out of your chair. So that's not an ideal thing. In the second picture, what you see is a facilitating environment where there's a ramp. It has to be at a right angle with something to hold on and all of those things. You don't want these really steep ramps that are just put there to tick a box. So suddenly this exact same person with the same impairment, the same activity limitation, is much less disabled and is able to participate because of this environmental barrier facilitator, which is the ramp. And this is a very simple example, but you need to think of people fearing mental illness, for example, and so not wanting to interact with somebody with a mental illness or not wanting to be near them. That attitude of fear is a barrier to that person with a psychosocial disability actually participating in various activities. Next slide. So let's get on to disability inclusion. So historically, people with disabilities have been included. It's those poor people, we must just keep them in institutions. Or, well, we really can't do anything more for you. You've got a spinal cord injury. You're just going to have to stay at home and do nothing, or go into an institution. You're no longer part of society. You cannot be seen as a full productive member of society because you've got this impairment that we cannot cure. That was kind of the traditional perspective, which led to this complete exclusion and invisibility of people with disabilities. If you look at, and I think it was Roosevelt, the American president, who used a wheelchair, and he used to be very careful how he was photographed to make sure that wheelchair never was seen. I mean, what a role model for disability inclusion if that had been made much more visible. So inclusion, UNICEF, and I thought it would be a good one to use given the wide interaction of UNICEF with the Global Parenting Program. So this talks about a world where all children, including those with disabilities, live in a barrier-free and inclusive community where children with disabilities are embraced and supported at every stage of life to realize their rights and achieve full participation in society. And they've got a disability inclusion policy and strategy, which they've been developing and trying to implement both within UNICEF itself, as well as all the countries that they work with. And the Sustainable Development Goals, the Leave No One Behind concept, talks about improving participation in society for children and adults who are disadvantaged on the basis of age, sex, disability, race, ethnicity, origin, religion, or economic or other status, leaving no one behind. And participation is improved through enhancing opportunities, access to resources, having a voice, and being respectful of rights. Next one. And this is UNICEF's framework for disability inclusion. So at a kind of broad level or macro level, it's the states provide and monitor data, budget, legal and policy frameworks, and invest in system strengthening. The states and communities provide care and support. And in the middle, you have all the different aspects, the actual services and programs that need to be provided, such as inclusive services. So making sure that the primary healthcare clinic is accessible for people, that the attitudes of the nurses there and the staff there are welcoming for anybody who does have a disability. And stigma and discrimination are tackled, that there's community mobilization, accessible infrastructure and transport, providing assistive technology, which is very important. I won't go through all of them. Next slide. And these are just some pictures of showing, the benefits of inclusion, of just making sure that people are part of everything rather than being separate. And I thought this was quite a useful diagram. So exclusion is where there's a central group of what some people might call normal people. On the outside of that is everybody who's excluded from not being normal and are different and excluded from the group. The integration would be where they're there, but they're in a special school separate from everything else rather than being in a mainstream school. Segregation is where there's complete separation. But this final one, the inclusion, is when everybody's really mixed in together. Next one. And Zui is also going to address this, but the important issue of the twin track approach is not forgetting that there are very disability specific aspects to look at. So somebody might need a very specific set of eyeglasses, or a specific type of wheelchair, may need a specific medication for their mental illness. So those are the disability specific parts of the twin track approach. Whereas there's also this mainstreaming part. So in forgetting about individuals, but just thinking, how do we create a society that's inclusive? So looking at the built environment, making sure that any new building that's designed includes a good physical access for people with disabilities, be they in wheelchairs, be they using walkers, a blind person using a white cane, a deaf person needing to be able to read where they can find themselves in a building, people with intellectual disability needing signage that is easy and simple to follow. So that's just one example of all the things one can think of. So in designing anything, a service, a policy, a building, a product, anything, think about all the potential people who could be using that and design it accordingly. Next slide. So just in terms of parenting, Zoe is going to talk a lot more about parenting a child with disabilities, but I think we also need to remember about parents who are disabled themselves, maybe parenting a disabled child, so a disabled adult, a parent with a disabled child, or a disabled adult, or a parent with disabilities. You can use the term interchangeably. It depends whether in the US or UK, which way around you talk about disabled people or people with disabilities. Where you have a disabled parent who's parenting a non-disabled child. So there are all sorts of combinations. So making materials accessible to the parents, checking whether digital programs do work with parents with disabilities. I'd imagine for somebody who's deaf, that's a very good way to go. Often other children or children who have a disabled parent might become support people for that parent. So bearing that in mind, how does that work? The 8-year-old who has to go with her deaf parent to the hospital to help interpret from sign language into verbal language. What are the implications of all of those things? I think that might be my last slide. Zui, next one. Yes. So over to Zui to give you more practical examples of what goes on.
Thank you. Thank you so much, Margie, for a great introduction to the overall background. And as Margie mentioned, I'll introduce some case examples of supporting caregivers in parenting a child with disabilities. So our overall strategy to support disability within GPI is the twin track approach, which Margie just introduced. So on one hand, we aim to mainstream disability within our programs by integrating disability-sensitive measures into our program design and evaluation. And on the other hand, we hope to design more targeted parenting support so we can assist them in addressing more specific needs related to disabilities, so we can further empower families living with disabilities. And our ultimate goal, as Margie mentioned, is to include them in more aspects of the society through parenting support. So first of all, I will introduce some of our efforts related to disability mainstreaming. So for mainstreaming, we did several things. So firstly, we integrated 2 two-stage disability screening items into the GPI demographic questionnaires. And these questionnaires are often typically administered during the baseline data collection of the evaluation of our GPI human digital playful parenting programs in each country. And the purpose behind designing and administering these items is to conduct a study pulling data across countries, and this will provide us with insights into the experiences of families living with disabilities in general parenting program. For example, while participating in a general parenting program may offer some benefits such as normalizing some parenting challenges, promoting social inclusion and creating social support networks. We also wanted to understand how disability status or different types of disability may have influenced the impact of the interventions, and we want to identify characteristics related to better or less favorable outcomes. And the items, the two-stage questions, are adapted from the Washington Group UNICEF Child Functioning modules. We chose to adapt the modules and into a two-stage questions primarily because of space limitations, because we aim to maximize the opportunity to integrate disability screening items into as many studies as possible, while balancing the need to minimize participant burden, because as you may know, the original versions of the child functioning modules has about 16 to 24 items, I think. And so now we have two sets of disability screening items, one for child disability and the other for adult disability. So this is the child disability question set, and it's reported by caregivers. So the first question is, does your child have any difficulties doing things or getting along with others compared with children of the same age? And the answers include yes and no. So if yes, the parents proceeds to answer the second question, asking what difficulties the child has. So this avoids all parents having to go through the second question. And we also have another set for adult disability, which is very similar to the child disability questions, so I'm not going into details. And additionally, for some programs, we have a self-report item reported by teenage participants in our parenting program. And this one is not followed by the more detailed question about asking about different types of disabilities. And there are several advantages and disadvantages in terms of using these two-stage disability screening items in our GPI demographic surveys. So the pros include the ability to reduce participant burden while also being able to identify different types of disability. However, there are also limitations. Firstly, the questions may be too brief to provide adequate sensitivity. And second, the adapted version has not been tested, so it's unclear whether the adapted questions can be interpreted in the same way as the original child functioning modules. So that's the disability screening in demographic questionnaires. Another aspect of our disability mainstreaming efforts was modifying one of our programs to improve its sensitivity to disability. And the program we modified is called Parent Text, which has two versions: Parent Text Young Children for 2 to 9 years old, and Parent Text Teens for ages 10 to 17. So for those who are not familiar with Parent Text, here is a very brief introduction. The Parent Text is a chatbot parenting intervention delivered through popular communication channels, for example, WhatsApp, Telegram, and WeChat. And the content of Parent Text is evidence-based, derived from Parenting for Lifelong Health programs and some other parenting programs aimed at reducing violence against children and promoting child development. So Parent Text gives parents an interactive learning experience by delivering parenting knowledge and skills through quizzes, comics, videos, audios, text messages, and more. It can be used as a universal intervention delivered at population level or combined with a human-led support to increase participant engagement and program effects. So to mainstream disability within Parent Text, we essentially did two things. One is the integration of developmental assessments into Parent Text, and the other is modifying the Parent Text messages to make them more disability inclusive. So let's take a closer look at the developmental assessments first. So the purpose of the developmental assessments in Parent Text is to identify parental concerns about child development and promote early identification of the risks of developmental delays or disability. So we do not want to conduct clinical diagnosis, and this is not feasible either in this type of intervention. So instead, our goal is to increase the chances for children with disabilities to receive timely support. And the developmental assessments we used are sourced from two instruments. For children under 5 years and 5.5 years old, we use the Survey of Well-being of Young Children, the SWYC milestone. This tool is age sensitive, so children of different ages will receive questions, and each set of questions has 10 items assessing child cognitive, language, social, and emotional development. And for children older than 5.5 years, we adapted, again, the Washington Group UNICEF Child Functioning Module 5 to 17. So this time we have 8 questions, allowing parents to express their concerns across 8 domains of child development. So for those who meet the cutoff score or report some concerning difficulties in one or more domains, we will provide a list of contacts and resources and encourage them to seek advice from professionals. So we use these tools, the SWYC and child functioning module, because they are scientifically tested, they're very user-friendly, and they have adequate cross-cultural reliability and validity. And also they are open source, which is very important for an intervention that can be delivered universally through mass media. Oops. So in Parent Text, after each module, parents receive a home activity where they're encouraged to practice what they have just learned. So to do this developmental assessment, we assign it to parents as a home activity in the modules related to child development. So the green box is a screenshot of this message saying that your home activity is to complete your child's development assessment. And in the following day, we check in with them to see if they have filled out the survey. If not, we prompt them again. And for those who express concerns, we encourage them to talk to a professional. In addition to the developmental assessments, we also made sure that our language is sensitive to disability. Here I have listed some principles of our disability mainstreaming, along with some examples of how we followed each principle. For example, first, we ensure that our language is inclusive. For instance, when we talk about communication, we emphasize that children may express themselves in different ways, including full sentences, gestures, movement, and sounds. So the red box is an example of the message. And second, we use empowering language. So we emphasize ability instead of disability. For example, we tell parents that every child has unique abilities and potential, and all children can develop skills, participate in daily activities, and learn through play. And the boxes are again some examples. And third, we advocate, as I just mentioned, for early screening and detection by incorporating developmental assessments. We inform parents that if they have any concern, they should consult a professional. And yeah, we make sure to provide a list of localized resources for families of children with disabilities or special needs. Additionally, we try to address misconceptions about disability. We emphasize to parents that their children's condition is not their fault. And we also incorporated some considerations for disabilities into our troubleshooting process. So the troubleshooting process in parent text aims to address common parenting challenges. For example, in instance where a challenge might be linked to a disability, such as difficulty adapting to any new routines, mental health concerns, learning difficulties or engagement issues, we make sure to offer a list of resources and contact information and encourage parents to access the support they need. For example, if a parent reports that their child doesn't want to play with them, then we might consider whether it might actually be an issue of engagement due to social or communication difficulties or something else. So this is not exactly what we say in the messages, but just want to give you a sense. And also, each module typically includes a comic in parent text. So we ensure that the comics depict people with disabilities. For example, in parent text Young Children, we feature a girl in a wheelchair, a boy with hearing aids, and a grandparent use a walking stick. And when adapting the comics, we make sure to present both a boy and a girl with disabilities interacting with their male and female caregivers. And this avoids reinforcing stereotypes that suggest mothers alone should care for children with disabilities, or a mother's action cause disabilities. And additionally, we depict children with disabilities in more positive conversations to avoid reinforcing the stereotypes that they are abnormal or less capable or unable to participate in activities. Instead, we show them participating in various activities just like other children. And also we try to, as you just see, we try to include different types of disabilities. And lastly, we try to depict disabilities as much as possible. People with disabilities are now represented across 6 out of the 8 parenting goals in parent text. What I've just introduced mostly focuses on children with disabilities. So to increase sensitivity to parents with disabilities, our amazing designers and developers of parent text have done the following. For example, they use high color contrast to improve readability and distinguish between elements. They provide multiple media modes, including text only, audio, video, and all videos include embedded captions. And when they design the messages and interactions, they prioritize simplicities and avoid complex interaction. For example, in some countries like China, users are only required to click buttons and occasionally input a number or a short trigger word. Additionally, things are designed in a way that users, for example, with vision or hearing disabilities can effectively use assistive technologies such as screen readers and screen magnifier. So by now, I have introduced our efforts to mainstream disabilities within our general parenting program. So next, so in the beginning, I mentioned a twin track approach, which means that in addition to mainstream disability, we also aim to provide some more targeted support and address their unique challenges. So next, I'll introduce how we plan to do so. So the simple answer is that we plan to adapt the Chinese version of Parent Text Young Children for families of children with autism in China, where I am based. I'm also leading the adaptation and testing of Parent Text Young Children in China. And here is a bit of context. So in China, like many other developing countries, there is a general lack of disability-related resources and information. But most of the resources are in large cities, and the needs of families living in other areas are often unmet. So to access reliable support, some parents who are very determined may have to travel across China, but there are also many families who do not know what they need and lack the resources to travel to get support. But given this circumstance, we just started to think about what we can do for those families. And after consultation with stakeholders and researchers, we found that there might be an opportunity to leverage digital methods, specifically our existing parent text intervention, to support families of children with disabilities, and particularly autism in rural and remote areas. So what we'll do is to combine digital intervention with weekly remote live coaching by facilitators experienced in has much experience in supporting families of children with autism, and this will be done through video conferencing. And we will not require an official diagnosis, but we will assess the severity of disability. And for those with severe autism, we will refer them to more intensive live support, and the digital intervention will be available to them as additional resources. And the Chinese version of Parent Text Young Children currently has about 38 modules. However, instead of providing all modules, we plan to shorten the content. We will select several of the most relevant topics and expand them to incorporate disability-specific parenting knowledge and skills, and they will be grounded in applied behavior analysis and some other social communication interventions. For example, to start with, we will focus on number 1, caregiver self-care and psychoeducation. Number 2, one-on-one time and child play. Number 3, praise. And number 4, instruction giving. So we will adapt and test them out. If they prove to be feasible and potentially lead to favorable outcomes, we will then proceed to include more topics such as routine, communication, behavior management, and future planning. And the remaining modules in Parent Text are still important, and we will make them optional resources for parents to explore based on their availability and preference.
Zoe, just giving you a 2-minute warning, Mark. 2 minutes left.
Sure, thanks, Jen. So next I'll give just 2 examples that how we plan to adapt the modules. The first example is the one-on-one time module, which now has 3 core messages to parents. First, try to spend one-on-one time with your child every day. play with your child and let them choose the activity and stay focused on your child during one-on-one time. So when adapting this module for parents of children with autism, then we may need to break it down into 3 separate modules and expand the content to include tips on, for example, how to set up the environment, such as removing distractions, how to determine whether and to what extent your child is engaged during the one-on-one time, and tips to promote joint attention during the one-on-one time. And another example is the power of play session. So the original parenting tips are number one, get active, and number 2, allow creativity. For the disability version, we may convert it into 2 modules. One introducing different types of child play, and the other introducing how parents can support children with autism learn through play. And I think that's what is what I want to share today. And we have one last slide for Marky.
I just thought, and Zui and I have discussed this a bit as well, is to potentially look at developing a checklist or disability inclusiveness for parenting programs. What are the things that you need to look for? And potentially use this checklist to help the core projects in GPI to review their interventions within this disability inclusion lens. And we thought it'd be useful to get some thoughts and ideas and suggestions on this. I mean, developing the checklist could be a relatively easy, I think, task that Zuri and I could lead on, but the others would need to, reviewing core projects would require your willingness to do this and interest to work with us on that. And that's all from us.
Thanks so much, Margie and Zui. Very thoughtful and thought-provoking presentation. I'm going to just have a look at the Q&A, and I almost think that people are able to raise their hand if there are additional questions that people might feel they want to pose instead of typing it into the Q&A or not being able to find the Q&A also. So I think the one question had been answered already via chat about the links to the presentation and the recording. And then the next question was from Lucy Richardson. A question about adapting the WG UNICEF CFM. Did you use the resources on translation and explaining reasoning behind language and structure of the CFM? Also, for the ordered questions, did you adapt the WG short set instead of CFM, if that helps? Question is in the Q&A if you'd like to have a look at it.
Zuri, do you want to explain what you did?
Yeah, thank you, Jane. Thank you, Lucy. So when we adapt the Washington Group UNICEF child functioning module, it did not actually involve any translation because it's in English. And we did not explain the reasoning behind language and structure for parents, but we do have a brief for our partners, our users of the implementation partners of the parent text, to show them why we integrate this and why we select this tool and what we did to adapt this tool for using parent text. And for the adult questions, yes, we use the short set instead of child functioning module. Thank you for the correction.
Thank you for that. I see Lucy's hand is up. I'm going to see if I can unmute you if there's anything you wanted to just add to that. Just give me 1 second.
Jen, I already added her. So Lucy, please go
perfect.
ahead.
Thank you. Lucy, you're muted. Yeah, I think you'll have to unmute yourself now. There might be an issue there. Lucy, we can't hear you. Lucy Richardson, if you have an additional question, maybe you could just add it to the chat. It doesn't seem like, oh, there we go. It says everyone's muted. Let me have a look here. That's strange. I think Mahi gave you...
Yeah, I made you a contributor in the call so that you can activate your microphone. So from our
You
side,
need to accept it. Yeah, you actually need to accept it from your side.
yes. Sorry, Lucy. Maybe we can go to another question while we sort that out, Solana.
Sure. There was another question. The next one was from Mulenzi. Wonderful. Lack of resources in rural areas is a challenge to inclusion. Also talk about mindset change. Parents with children with disabilities are not disability inclusion aware. So it feels as though that's a comment. But maybe if you do have a question, you can just add to that, I think. Any comments on that from Margie and Zui around the lack of resources?
Shall I comment? I think it's a real issue. That doesn't mean you can't do inclusive work and disability inclusion in areas where lower resources. I think it's just because, it's a bit like, I suppose, saying if people are poor, they can't parent well and they can't love their children. That's just complete nonsense. It's about looking at what there is and looking at at what can be used locally. So changing the attitudes would be an obvious thing. Helping parents to be able to care for their child. So doing some training of parents so that they understand how to manage their child's disability and that they don't feel completely isolated and left alone to manage this really big task of caring for their child, which is often exhausting and can really lead to burnout. So, I think the lack of resources doesn't preclude doing or developing a more inclusive or disability inclusion. Yeah. So I don't know if you want to.
Thanks, Margie. I think it almost touches on the next question, and we'll get back to Lucy in 1 second. Are you considering developing parent networks for peer support and learning? So he's unmuted.
I'll take this one then. I think that's a great point because in rural areas and in remote areas, parents of children with disabilities are often very isolated because of lack of resources, because of stigma, stereotypes, and peer support and learning is a very important part to empower those families. So currently, we'll definitely have a group, an online group of parents, an online group or platform for parents to interact, but we haven't come up with a very structured a structure to how we can facilitate this kind of group. So it may be more of a natural, casual interaction of parents, but we welcome any suggestions how we can facilitate this kind of group to further empower them and provide them with more meaningful and experience where they can gain more helpful tips maybe from other parents.
Thanks, Zoe. Lucy, are you able to unmute now so we can get back to your question? Oh, okay, it's not working. I think Mahi will try and add you as host, and we'll try that again. There we go.
Is it working?
Yes, it is.
Oh, that's very exciting. So sorry, what I was trying to ask with whether you use the resources available, talking about translation and information about why and how the child functioning module was created, and the way that the functioning module was structured, is because it gives very helpful insights into the language that was used and the specific words that we used, and like very like it's very clear onto like the way that it's structured. And I just think that would have been really helpful in trying to adapt it. And I understand that, I mean, it's sorry, I should say that I am from UNICEF, Disability Inclusive Child Protection Specialist. Should have started with that. And so very familiar with the child functioning module from quite a while back. And so I think, yeah, I just think those resources are really, really helpful when you're trying to apply it, in different contexts. And although, of course, the idea is for it to be used in its entirety, it is very difficult, I think, in a lot of contexts to try and do that. So I think, yeah, maybe, taking another look at those resources is really helpful, to try and get the best possible result, as it was originally designed to try and like replicate as close to possible, even when that's not really possible, because there were a couple of the words that were used there that I think could definitely, maybe you could like switch around a couple of words and you would get even better results. That's what I was thinking. And I didn't hear what you said on the short set for the adults, but I think that's, really helpful as well. But yeah, thanks. This has been really, really interesting to hear about. So thank you.
Thanks so much, Lucy. I'm not sure if Margie or Zoo has anything to add to that.
Just to say, I think that there is the adult short set for that should be used, and is relatively okay to use from age 10 up, but not really below that, and certainly not below 5 years of age. And that's why the child functioning modules were developed. But if anybody does have questions around the Washington group questions or anything, I'm very happy to have a discussion with you. I'm very involved in the Washington group, and we're in the process of developing psychosocial disability functioning, or psychosocial functioning questions, and testing them as well. So yeah, I think that's a completely separate webinar as well, and it could take a good full webinar just on that.
Thanks so much, Margie. So there's still a few questions in the Q&A, and I know people would want to jump off on the hour, but if you can stay on for extra couple of minutes, and we'll get the presenters to actually answer these questions. And so it will be on the recording as well, if you want to link to that a bit later. But I think we'll just ask the speakers to answer these questions live now. So if you can stay on, please do. Another question that had come through was, excited about an intensive disability inclusive version of parent text. Is access to this intensive disability inclusion version available to all parents, or is it being distributed selectively to certain parents?
I'll take this one then. So for all parents, the program will have two parts. One is the digital parenting intervention, and the other part is the intensive, the human-led live support. So all parents will receive these two components, but for parents of children with severe challenges or severe difficulties, we will refer them to more intensive support. So in this case, the digital intervention will not be the focus. They will need more intensive live hands-on support, either through video conferencing, because they cannot travel across China, or if it's possible to access in-person support, we will try to connect them to more in-person support. I hope I was being clear.
Thanks so much, Zoe. The next question, are there any examples of implementing the program in rural areas where internet connectivity is a challenge, and as in there might not be any available to have a weekly coaching session? Yeah.
That's a great question. Actually, for now in China, because I'm also adapting the general parenting program for delivery in China, in both city and rural areas. But for now, we haven't come across any cases that internet connection is an issue. But we do implement the program, we are soon, in the next couple of weeks, we'll be implement the program in rural areas, and we are doing the demographic surveys, and we haven't come across any, but I think this will be a challenge for some families, definitely. And in that case, I think we will need, because we also have facilitators, home visitors, I think we will need to sort this out in either providing with them with data support, or invite them to the nearby facilities where there is internet connection. But for the disability version, we may be targeting parents who have internet connection first, because it's a feasibility, it's a tryout. So we will focus on the parents first, and then maybe as a next step, we'll make it more inclusive for parents who have more lower digital literacy, or more limited data connection. But thank you very much for bringing this to our attention.
Jen seems to have frozen. Maybe should I read out the next question? One of the stumbling blocks for ensuring parent or ECD programs can be fully inclusive and supportive of parents and or children with disabilities is that so often facilitators or community health workers themselves have unchallenged biases. How can we ensure that parenting programs take this into account? I think here it's about anti-stigma work, it's about awareness, it's about teaching them skills of how to manage disabilities. So I think often those biases come from how do I talk to somebody in a wheelchair? How do I manage a child who has severe cerebral palsy? And so giving basic skills on how to do that can help reduce that fear, and then make it easier for them to start interacting with people, and hopefully through that start reducing their biases. I mean, biases are very hard to get rid of, but it's through exposure and through, I presume, initially facilitated exposure and training on how to manage things that will slowly resolve itself.
Thanks,
Jen?
Margie. Lucy, I see your hand is up. I'm not sure if that's a new hand. That disappeared very quickly now. So it might have been from the first round. Then Catherine Morse has a question around, do you have any sense of the follow-through from parents identifying possibly developmental delay or disability and then accessing suggested services or information?
Well, I can only speak from my understanding and experience in China. And in China, it's usually through the house system. The parents in rural areas will need to be referred to a town hospital or clinic, and then they get advice from a professional, and their information will be registered in the system, and then by collaborating or collaborating with local governments or the health system, we get the contact information for those parents and we reach out to them. And also they will be left with some leaflets, only some very limited information. But on those leaflets, they will have information or contact for the more well-known or reliable service agencies. So that's typically the experience of families of children with autism in China. I'm not sure of other countries though.
Margie, anything to add?
No, not to that. I think it's.
Thank you. Next question. This is from Mulenzi. The parenting group training TOTs can be helpful, like selecting few from each group who can go back and facilitates the rest. Yeah. Seems like a comment. Yeah. And then Terry saw the parenting program sounds amazing, especially the specialized and intensive in-person support. However, are there any plans to scale up these programs nationally, especially in a large country like China? If so, how would these look like? What would these look like?
That's a great question. We hope there would be a chance to scale up the program. But we will test the feasibility first to see if the digital method combined with human-led support is acceptable and is effective for those families. If they are acceptable, feasible, and effective, then we may think about potentially scale up the intervention. And I'm not sure how this would look like because it sounds very intensive. But I hope there will be a chance to think more about this once we have proved the feasibility and the effectiveness.
Okay, thanks so much, Margie and Zui. I think we've answered all of the questions. I'm just having one more look. There's a follow-up from Catherine. Following on from my question, I was more interested in what percentage of parents are reporting that their child has a disability, and then of those, what percentage seek services. Reason is that we have difficulties getting uptake in our Eastern Cape parent research, so Eastern Cape, South Africa. Yeah.
We haven't get the data yet because the GPI studies are still undergoing. But I am more than happy to share with you the percentages. If you can leave me your email address or any other contact information, I'm happy to share once the results are ready.
Okay, thanks so much, Zoe. I can even put you in contact with Catherine if you need. Sure, I think we've covered everything. Thank you to everyone who stayed on for an additional 8 minutes. We'll definitely have the presentation ready, I think about in a week or so, maybe less. Thanks again to Margie and Zoe for presenting today. I think it was well received and quite a bit of interest from people as well, especially because there isn't that much research around disability inclusion in parenting interventions. So I think we had quite a good turnout. And then also to everyone on the call, look out for our next webinar. But take care, everyone. And thanks for joining. Thanks for joining.
Bye, everyone. Thank you.